We're now live. You can go ahead.
Thank you for joining us today. My name is James Gore. I'm chairman of the Sonoma County Board of Supervisors for this year. And I want to welcome you and thank you for joining us for our COVID-19 update for Wednesday, January 12th. I'm going to begin with a brief message from Gilbert Martinez from our communications team for our Spanish-speaking viewers. Gilbert.
Buenos días y bienvenidos a la sesión informativa. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Y ahora regresamos para atrás con Supervisor James Gore.
Thank you, Gilbert. I want to start with a top line first. Everything we have done since the onset of this pandemic has been to protect the health and safety of our residents in Sonoma County, while at the same time ensuring that our kids have the ability to go to school and that our businesses have an ability to survive and thrive in spite of these chaotic times. At the same time, I want to be clear about what's going on and what's not going on. We do have a health order surrounding large indoor and outdoor events focused on minimizing the transmission from those heavy events and how it's impacting our health system and our community at large. There was also a recommendation on stay at home unless there's essential reasons to be out in the community. The reason for that is that every time we see people go out, we see these numbers surge. So it's a reminder that as we're still in the tail end of our winter, January, February through March, we have not just the 30-day order, but we also have a recommendation asking you to minimize your contact with other individuals. Get tested if you're sick, contact our health office if you test positive with either an antigen or a PCR for COVID, and make sure you take care of you and yours. The reason we're doing all this is because on Christmas, we were averaging a little over 120 new cases a day in Sonoma County. Today, we're averaging more than 700. That's a 500% increase in just 8 days. This is, without doubt, an unprecedented surge of COVID cases here in Sonoma County. Meanwhile, the results of this is that our hospitalizations due to COVID have increased from about 25 a day to now more than 80. At the highest point during this pandemic, our average number of COVID patients each day in our 6 Sonoma County hospitals was up to 104. But the state is projecting in its modeling that we could average more than 380 hospitalizations by the time this surge is done. What does this mean? It means not only more people are going to the hospital, it means that not only are more vaccinated people getting sick, but more unvaccinated people are still going into the ICU system. And it's not just a danger to them as they occupy those beds. It means that our hospitals are less and less able to serve normal ICU purposes that are absolutely essential in our community. Furthermore, our hospitals, just like our schools, just like your businesses, are experiencing high infection rates for which people are staying at home, which minimizes our staffing ability to deal with this surge. No matter who you are in this county, you have not only a right to be a part of living your life, moving, running your business, and doing other things, but with rights come responsibilities. And the responsibility that we're talking about is to make sure that you look at how your action affects the downstream result. It's not just about your event. It's about how that impacts the ICU and that individual who needs service. So take it upon yourself to do what's right, follow the health order, and do what's needed to move forward. We took the step of not only encouraging residents to stay at home unless it's essential, but also to limit individual outdoor events to 100 individuals and indoor to 50 by saying that we need to move on this now to remain, and it will remain in effect for 30 days until February 1st. We're going to talk more about the order and guidance. I'm going to look to Dr. Sundari Mace and her team to do that. And I want to remind you that the reason we're doing this is not just because of a systematic approach, it's because of what we're dealing with personally. I, for one, have 2 kids in school. They're 7 and 10. I got a note from my school recently that said if more than 30% of the students in a class are not there for one day, we're going to have to move to online learning. Online learning is not where we want to go back to. It's not where our teachers want to go back to. It's not where our kids want to go back to. I also had a conversation with something that hit the news recently. That was a business owner being responsible. I want to call out in a positive way Natalie Salurzo from Russian River Brewing Company, who I talked to this morning and over the past 2 days. And they have an event, the release of Pliny the Younger, a cold beer that brings thousands of people here to Sonoma County and does amazing work. She talked about why they were delaying, and she told me very specifically, I want to tell you, and I want you to share with your health team, that we're following the order. We do not want to be a part of bringing people to town and sending them to our hospitals and further shutting down our economy. She said, we also have more than 20 individuals who are sick within our own staffing, and we have to deal with this personally. And she also said, while this is frustrating, we have to focus on pivoting it towards the future. And this last kick of Omicron is getting ahead of it. I want to applaud people like Natalie. I want to applaud folks on our public health, and I want to applaud all of you. My daughter's sporting events and my son's have recently been canceled. That was previous to this health order. That was because individuals in our community were standing up and being responsible about how close contact we're in right now and where we're at as a community that currently has about 85% of our individuals all or partially vaccinated, and we're doing more to get there. We need to do this to protect each and every one of us. I, like you, am tired. At the same time, I can't be too tired to do what's right. In my own home, in my own family, we had some people over last night. We sat across the dinner table with masks on. We made sure we were 6 feet apart. Why? Because I'm trying to be responsible. And I also understand that while a lot of this stuff, people think about their rights and they think about their freedoms, when we mask up, when we social distance, it's really an inconvenience. And an inconvenience for all of us as individuals and as a local society is something we have to make for these unprecedented times. If you're frustrated, you can always call me. We get a lot of accusations. I want to let you know, my colleagues and I, the staff on this call, they're doing what's right. They're following science. They're being risk averse because this is impacting not only people's lives who are in the hospital, but those who need to go to the hospital for non-COVID reasons. And they're doing it to try to keep their kids in school, and they're doing it to try and keep their businesses open. I want to thank you very much and pass this over to Sundari Mace. It's a pleasure to be with you here today. There's going to be a lot of question and answer that's responded to. Blessings to you all, and let's get to the spring.
Thank you so much, Chair Gore. First of all, I also want to acknowledge that I too am tired of dealing with COVID. We all want to be past it and get back to life as normal, but we're not there yet. All indications are that this surge is likely to get worse before it gets better. That's why on Monday, I appeal to all residents to stay home as much as possible for the next 30 days and limit interactions with those outside of their immediate household. We recommend that people limit travel to going to work or to school and only making necessary trips, such as going to the grocery store or the doctor's office. This is not an order, it's an appeal to the community to try to keep yourself, your family, and everyone else in the community safe. You don't have to stop supporting restaurants. We would just encourage you to support them for the next 30 days by getting takeout orders. And as Supervisor Gore mentioned, I also issued a health order that prohibits gatherings of more than 50 people indoors or more than 100 individuals outdoors if social distancing is not feasible to prevent the further spread of Omicron here in Sonoma County. These steps are necessary to reduce the likelihood that many more people will be exposed to COVID-19 at a single event. We know this is happening with Omicron, And we know that this step will slow the spread of Omicron in our communities. We have widespread transmission of COVID right now. And we've had many situations in which people have gotten sick and there have been large outbreaks, and 50% of the people participating in events have gotten Omicron over the course of a few days. As of today, our case rate has risen to 172 per day per 100,000 residents. And our testing positivity rate is now 19.2%. That's already significantly higher than it was just the other day. At the height of the Delta surge, our case rate was 34 per 100,000 per day, and our testing positivity was 8.3%. And during last winter's surge, our case rate reached 54 per day per 100,000, and the testing positivity topped out at 9.6%. So we are really well beyond those numbers, suggesting that we do really have widespread community transmission. So while we expect our case rate to continue to climb, we could see the peak by late January. And I really hope that means that we'll be on the back end of this surge soon. Our hospitalization rate has doubled in the past week, but remains below previous surges. There are currently 80 people hospitalized with COVID, compared with 84 at the height of the Delta surge and 104 last January. Our high vaccination rate is an important reason why outcomes are not as bad as in other stages of the pandemic. Unvaccinated people in Sonoma County are 2.4 times more likely to be infected with COVID, 17.9 times more likely to be hospitalized with COVID, and 13.7 times more likely to die of COVID than our vaccinated population. We also, as Supervisor Gore mentioned, worry about how the surge is disproportionately impacting our older residents and our low-income communities of color due to multiple risk factors, including the multi-generational households and the use of shared transportation. These factors place these people at higher risk of becoming infected with COVID-19. Aside from this health order, there have been several changes to health guidelines recently. So let's look at the most up-to-date guidance. Masks are required in all indoor public settings, regardless of vaccination status. The state extended that requirement for another 30 days until February 15th. There is no more exemption to the mask requirement for stable cohorts of vaccinated individuals here in Sonoma County. Wearing an approved face covering like a well-fitting surgical or N95 mask remains one of the easiest ways to prevent the spread of the virus. Cloth masks are not as protective as those masks and are not recommended. So do use a well-fitting surgical or KN95 or N95 mask. We know that getting fully vaccinated and getting booster shots continues to be our best tool in controlling this pandemic. So let's hope, and I'm hoping that we'll be in the back end of this surge, and let's get through this together. So for more on our vaccination campaign, I'm going to turn this over now to Dr. Urmila Shende, our vaccine chief.
Thank you, Dr. Mace. We want to thank everyone who has received a dose, including boosters. Because of your efforts, Sonoma County has the 9th highest vaccination rate of the 58 counties in California. We've now administered more than 938,000 vaccine doses, and nearly 78% of the eligible 5 and older population are now fully vaccinated, with an additional 7.9% partially vaccinated. We're doing quite well. Our school-based pediatric vaccine clinics are back after the holiday break. School clinics will be held tomorrow, Thursday, at Valley Vista School in Petaluma and Cesar Chavez Language Academy in Santa Rosa. A list of the future school clinics is available at the Sonoma County Office of Education website. Our 5 to 11 population is now 24% fully vaccinated, with another 15% partially vaccinated. So 39% have had at least one dose. So we're well along our goal of getting 50% at least partially vaccinated by the end of January. On the booster front, we have administered more than 176,000 booster shots to eligible residents 12 and older, providing important protection against the highly contagious Omicron variant. 67% of those over the age of 50 who are booster eligible have received them, and 54% of those over 12 who are eligible are now boosted. If you're required to get a booster before January 31st for work, please know that we have appointments available at our 2 fixed locations at Rona Park Community Center, which is operated by LHI, and the Roseland Community Center. You can find out more information about these sites at socoemergency.org/vaccine. The CDC and FDA last week approved the Pfizer booster for 12 to 15-year-olds if they are 5 months past their second dose. In addition to requirements that healthcare workers get vaccinated, the California Department of Public Health last week issued a health order requiring all visitors to hospitals, skilled nursing facilities, and residential care facilities to show proof of full vaccination and a booster if eligible, or to show proof of a negative COVID test. Besides vaccines, testing remains a critical piece of our COVID response strategy, especially with children and teachers back in the classroom after the holidays. Testing is the best way to know your COVID status. Even if you're symptomatic, if you think you have been exposed to someone with a positive case, get tested before going back to school or work or any place where you could possibly expose other people. That said, we know that tests are very hard to find right now. We're doing everything we can to help our testing partners expand their capacities and to provide more appointments for you. And as we've noted before, this is a problem not only here, but throughout California and nationwide. We are trying. But we know that, as with our hospitals and clinics, our testing providers are also experiencing staffing shortages, which is compounding the problem. If you don't need a test, please wait. You can find information about testing opportunities at socoemergency.org/test. For local vaccine clinics and how to make an appointment, visit socoemergency.org/vaccine. With so many people testing positive these days, there's some confusion out there about what to do if you've contracted COVID. So I'd like to take a minute to walk through the process and review the recommended steps. So if you test positive, the first thing you should do is to isolate for at least 5 days. Get a test on day 5 if you're able to, and if it's negative and you're without fever for 24 hours and any symptoms you have are improving, then you can end your isolation. If you can't get tested, you can end your isolation after 10 days if there aren't any symptoms. If you used an at-home test, you should report the results to the county health department at 707-565-4667. Please note that if you do come out of isolation at 5 days, it still is important to wear a well-fitted mask for a total of 10 days. Notify close contacts that they've been exposed. A close contact is still considered to be somebody who spent at least 15 minutes over a 24-hour period within 6 feet of a person who's positive for COVID. People who are fully vaccinated do not need to quarantine after contact with someone who had COVID unless they have symptoms. However, fully vaccinated people should get tested on day 5 after their exposure, even if they don't have any symptoms, and they should wear a mask indoors in public for 10 days following exposure or until their test result is negative. So for unvaccinated people or those who have not received their booster but are eligible, these people should stay home for at least 5 days after their last contact with a person with COVID. If they have no symptoms or any symptoms are improving and they're able to test on day 5 and that test is negative, then they can come out of quarantine. They should wear a tight-fitting mask for a total of 10 days at home and anywhere they go. If they're unable to test, they should stay quarantined for 10 days. If they have symptoms, they should self-isolate and contact their healthcare provider. I'll now turn it over to Kate Pack, our lead epidemiologist, for an update. Kate?
Okay, thank you, Dr. Shende. I'm gonna pull up the slides. Okay. So looking quickly at our latest metrics, as Dr. Mays mentioned earlier, we've seen a dramatic rise in cases. You can see here our case rate per 100,000 residents from January 2021 to present. In a short amount of time, our case rate has increased to almost 173 new cases per 100,000 residents. Our test positivity has likewise increased beyond levels that we have ever seen throughout the pandemic. We are at 19.2% overall test positivity and at 21.1% positivity in the lowest quartile of the Healthy Places Index. And those are those areas of the county where residents have less access to resources to support their health and well-being. We currently have 80 individuals hospitalized with COVID-19. And as was mentioned, we're not quite at the levels that we saw during the Delta surge in our prior winter surge, but we have seen an increase over a short period of time. And we'll look at the characteristics of those hospitalized in a little more depth later in these slides. I also wanted to note that we are conducting a record number of tests in Sonoma County. As of today, we're conducting over 1,000 tests per 100,000 residents per day. And one question that's come in from the public several times is whether our case rates consist of PCR tests, so these tests listed here, or whether our case rates also include antigen tests. And the case rate that we're reporting here of 173 new cases per 100,000 residents only includes PCR tests. So our actual case rate may be much higher. And looking since the Delta surge, 103 individuals have died from COVID-19 complications. Looking at our case rates by vaccination status, we continue to see that unvaccinated residents are at greater risk of becoming infected with COVID-19 than are those who are fully vaccinated. As of today, the case rate among the unvaccinated population in our county is 372 new cases per 100,000 as compared to about 126 new cases per 100,000 among those residents who are fully vaccinated. Looking at case rate by race and ethnicity, we have seen since December a sustained increase among Black African-American residents. And the current highest case rates are among American Indian, Alaskan Native, Latinx, and Black African-American residents. Another question that's been raised in the last week is why we saw such a large number of cases reported, particularly over this past weekend. And so I wanted to talk a little bit about the changes in methodology that were needed in order to address the very large surge that we have seen. So last week, the unprecedented volume of cases that we've seen with the Omicron surge overwhelmed our processing capacity for the first time throughout this pandemic response. The solution that we came up with was in finding our cases to link directly to our lab file, as well as CalReady. And CalReady is the state's infectious disease database. And what this does is it ensures that all positives are represented in the daily case rate, even when processing delays occur. And the solution that we're using is the same solution that is being used by CDPH to avoid backlogs during the surge. So the recent cases reported included the very large number of cases that we are seeing daily, as well as those positives that were temporarily backlogged prior to linking to the lab file. Looking at our source of infection, you can see here that gatherings, we're accounting for about 50% of cases where source of infection was known, with the majority of those being large gatherings shown here in the orange. And those are gatherings with more than 10 people present. Currently, gatherings count for 44% of the cases that have a known source of infection. Looking at vaccine outcomes, as was mentioned earlier, we're finding, looking at the past 90 days, People who are unvaccinated are 2.4 times more likely to be infected with COVID-19, almost 18 times more likely to be hospitalized, and almost 14 times more likely to die from COVID-19 complications. So we continue to see a powerful protective effect from vaccines. And looking at state modeling, we also see the importance of booster doses and staying fully updated in order to decrease the risk of serious illness and hospitalization. So in this state modeling, this suggests that depending on the proportion of our hospitalization who stays fully updated with vaccination, so gets a booster dose when eligible, we could see the possibility of nearly 400 COVID-19 hospitalizations this month. With higher rates of vaccination, this projection may be lower. And going back to this slide quickly, when we're looking at risks of serious illness and hospitalization, when we look at our hospitalization data currently, we see that, and this is as of data last Friday, every patient that's in the ICU for COVID-19 is unvaccinated currently in Sonoma County. Looking at our booster dose administration, 53.7% of currently eligible 12-plus-year-olds have received their booster doses, and about 67% of eligible adults over the age of 50 have received their booster dose. We continue to see areas of disparity when we look by our equity metrics. So 47% of those in the lowest quartile have been boosted who are eligible, as compared to 61% in the highest quartile. Looking at booster doses by race and ethnicity, we see similar disparities, where 62% of those eligible among the white non-Hispanic population are boosted, as compared to 34% among the Latinx population. Looking at our hospitalizations, we can see this increase that I mentioned earlier. And this graph above shows the proportion of ICU patients who are COVID positive versus patients who are hospitalized for other reasons. So you can see while our overall hospitalizations have gone up, we have not seen a dramatic increase yet in terms of ICU patients. A question that's been raised frequently is how many of our hospitalizations are due to COVID? So that COVID is the primary reason that patients are hospitalized versus incidental COVID. So patients who may be admitted for a different procedure and they happen to test positive for COVID. So what these charts are showing is by week in the dark blue, the patients who are admitted for COVID versus patients who are admitted for other reasons, incidental COVID. And I wanted to note that when we provide data on our hospital capacity page, this is based on data reported by the hospitals the day prior. So it provides a more real-time picture of how many COVID positive patients are hospitalized, but we do review all hospital records. So all data that's reported on our hospitalizations and deaths page and the hospitalizations that are factored into the rates that we're referring to, that unvaccinated are more likely to be hospitalized than those who are vaccinated, are all based on confirmed COVID-19 related hospitalizations. But looking at our record reviews, what we do see, this is the proportion of patients who were admitted specifically for COVID-19. We do see that this percentage is decreasing. So currently about 68% of the patients hospitalized are admitted specifically for COVID. And we expect to see this because we have such high rates of community transmission that there's a greater likelihood that patients will test positive for COVID-19. However, this is still a very important capacity indicator for hospitals because when patients are COVID positive, Hospitals have to take special precautions to avoid spread and outbreaks, and it also increases risk for hospital staff themselves becoming infected, creating staffing shortages. Looking at trends in age of hospitalized patients, you can see here, for example, that during this Delta surge, in the light blue here, more 50 to 64-year-olds were hospitalized. And when we look at 65-plus-year-olds, well, these patients accounted for some of the majority of the early hospitalizations. These rates went down during the Delta surge. We are again seeing more hospitalizations among the 65-plus group. One other important factor to mention in terms of vaccinated versus unvaccinated patients is when we look at data from June to present, we see that unvaccinated COVID-19 patients, and these are patients hospitalized specifically for COVID, tend to be much younger than fully vaccinated patients. So the median age of unvaccinated COVID-19 patients is 54 versus 73 among those who are fully vaccinated. And unvaccinated patients also tend to be admitted in the hospital for a longer period of time as compared to those who are vaccinated. Looking at our vaccine administration, we can see that 78% of our population 5+ is now fully vaccinated. Looking by age group, the range by age group ranges from 24% of the 5 to 11-year-old age group fully vaccinated to 93% of those age 70+. And we continue to see disparities by race ethnicity, with a smaller proportion of Latinx, American Indian, Alaskan Native, and multiracial residents age 5+ who are fully vaccinated as compared to residents of other racial and ethnic groups. And that's the end of my slides.
Great. Thank you, Kate. We appreciate that information. Good afternoon, everybody. I'm Paul Gullickson, Communications Manager for the County of Sonoma. I would now like to introduce Dr. Gary Green. He's an infectious disease expert with Kaiser Permanente here in Santa Rosa. And Dr. Green, thank you very much for joining us again today. Would you mind giving us an update of what you're seeing at your hospital?
Hi, Paul. Thank you very much. Actually, I'm at Sutter now, so at Santa Rosa Sutter Hospital. Yeah, at Sutter Santa Rosa, we're seeing a bump in cases. We're seeing a bump in hospital cases. We have almost a dozen patients in the hospital right now. Last week, I had a handful of patients in the ICU, and all of those patients avoided intubation, which was really good. We didn't see that in the Delta surge. But 99 to 100% of the cases we're seeing in the hospital are younger and they're unvaccinated. I really worry about the elderly age, and it's good to see the data from public health to know that the elderly are being hospitalized. We're not seeing as much of that, but I really worry about them because we know that with immunosenescence, they lose their immunity a little bit faster, especially over the age of 80. Now our ER and on the ambulatory side, the docs are really busy. Our ER is swamped. And our ambulatory docs are swamped with not only phone calls, also with patients who have mild symptoms and are very worried about COVID. Our testing rate is above 20%, and I bet if I did it today, it'd be 30%. So we're in the 20 to 30% testing rate for symptomatic patients and almost a 20% for asymptomatic. So clearly we're seeing a much more contagious virus. We're seeing much more community transmission. And what we worry about is if you don't keep your bubble small, we worry about our staff getting sick and then not being able to staff the necessary places in the clinic or the hospital. So we're being really diligent and careful about encouraging our staff, one, to get boosters, and two, to be very careful about their public interactions, because we certainly don't want them to become ill and then they run short on staff in the hospital. So from the very first part of this Omicron surge, we've been looking at that very carefully. Our hospital's full. I mean, it's a winter time, and so we're full of normal stuff. And then you layer that on top of this, and what I see in my colleagues is tremendous compassion fatigue. So the compassion fatigue is really, really tough. And it's important that we kind of support one another.
Dr. Green, based on your knowledge of this variant, and you've seen a lot of different variants over the years in your practice, do you think there's a real chance? I mean, do you think that the state projections that we could see a tripling of our hospitalizations if we're not careful over the next 3 weeks? Where do you think, what do you see as a trajectory on this?
Well, I think that really depends on a number of factors, and different communities are going to experience this surge differently. With our high vaccination rate, and I think with with the Dr. Sunny Mays' health orders to try and curb public transmission, I think we'll be situated better. Now, what we saw in Africa, where this Omicron started in South Africa, they had a sharp spike and a drop. And they have a vaccination rate in some areas less than 3%. So if we have a higher vaccination rate, I think that Sonoma County is going to be better situated than other places. I also, even though I see people in the community and even with patients kind of grumpy and tired and exhausted, I don't see people being as difficult with their individualism. So I think people are, when you walk into Costco, everyone's washing their hands, washing the cart, and wearing a mask. And I think that's going to be really good. So I think we're going to see a bump to the Omicron in our hospitalization rate. We're already seeing that already. And what happens in our community, which is interesting, is that different hospitals feel it at different times. So I think perhaps Memorial or Kaiser might be having a tougher time with it than we are at Sutter, and that just comes later. It kind of hits us at a different week. One thing I do think there are some silver linings to the pandemic. One, this is the very first time in the pandemic we've had a less virulent virus. It's more contagious, but less virulent. And I think evolutionarily, I think we've turned the corner, and hopefully this will be more endemic. The other thing is I think we never had in 1918 a vaccination. I think the vaccination plan is really going to be very critical to our success in avoiding deaths and hospitalizations down the road.
That's great. Thank you. We hope you'll hold on. We have some questions that from our viewers that we want to direct toward you in just a few minutes. But if I could go now to Casey D'Angelo from the Sonoma County Office of Education. Casey, thank you for joining us. Do you want to give us an update of what's going on at the schools, particularly with the handing out of masks and test kits?
Certainly, Paul, happy to. So last week, we were able to get out antigen tests to all public school students. And we, in fact, had 2 tests given to every student. And those are used for screening to see if they might have COVID. And I think that helped. The problem is because they came after the winter break and there were lots of gatherings then, our infection rate at schools is going up, and there are absences because of that. This week, we are getting a mask, KN95 or N95 mask for every student and school employee. And those are at the county office, and they'll be distributed starting tomorrow. And so County Public Health has really encouraged people to wear a better mask and not cloth mask. And so we're glad that we'll have the better mask to give to all students and staff members.
That's great. Thank you very much. I understand there's a problem on my audio, so I try to keep it short. But Doctor, we're now going to take some questions from the audience, from our viewers. Dr. Mays, would you start us off? We're getting a lot of questions about youth sports, and there's a perception out there that this health order is going to prevent parents from watching their kids participate in sports. Would you address that and clarify that if you could?
Yeah, absolutely. And you might want to log on and off, Paul. Yeah, thank you so much for asking the question about youth sports. We do realize that these are stressful times. And as the mother of school-age children and athletes, I understand the joy you all feel in watching your children participate in team sports. That said, we are seeing a surge right now of COVID cases that's unprecedented in our community. A surge that's already taxing our testing centers, clinics, and hospitals. Our hospitalizations, as we've just noted already, have increased from 25 on Christmas to 80 today. And the evidence shows that the bulk of these recent cases are coming from the large gatherings. In fact, since December 1st, we've had 34 sports-related cases, which we believe is an underestimate due to a backlog of cases right now at public health. The majority of these cases have occurred at basketball games, but we've also seen spread at other indoor and close contact sports, including volleyball, wrestling, and soccer. As a result, we considered various options, such as canceling athletic events and or banning spectators, but we settled instead on limiting all occupants to a maximum of 50 people in indoor events and no more than 100 for outdoor events when social distancing of 6 feet per person or cohorts from the same household is not possible. Our hope is that this would help contain the spread of the virus that is occurring at these kinds of events, while still preserving the ability of athletes to participate and of parents to watch their children compete over the next 30 days. We're not giving directions to schools on how to regulate the number of spectators at these indoor contests, but it is certainly our hope that they would find a way to give preference to attendance to parents of seniors. We love and enjoy watching sports as well, but we feel we needed to take this step to protect the health and safety of our community, which is our highest priority. I hope you can understand that. With any luck, the surge will taper soon. We'll be able to lift these new restrictions as soon as possible. Thank you.
Thank you, Dr. Mace. Is that better? Did I sound better? Okay.
Yes.
Thank you for raising that. Another question I'm going to direct to you, Dr. Mace, if you will. A question we're asked, why is Sonoma County doing this while other counties are not? Would you mind addressing that?
Yeah, thanks so much. I think it is a great question. First of all, we do things in a data-driven way, and we saw, as Kate Pack just showed us, that the majority of our cases are occurring from gatherings. We know we also have widespread spread of the Omicron variant, as you can see from our increasing case numbers. But what to me is more concerning is our hospital capacity. And that's something we've worried about throughout this pandemic. Luckily, we've never gotten to a place where our hospitals are so overwhelmed that they can't admit people who need to be admitted. And this isn't just about COVID. My worry is that if people go to the hospital for other illnesses, heart attacks, strokes, emergent other health conditions, that there will no longer be capacity for those persons to get adequate care as they should. So one of the things that's impacted us this year versus last year are significantly more staffing shortages. All the hospitals are understaffed at this point, and our skilled nursing facilities as well. And although luckily, although we're seeing a huge increase in cases, it's not translating into the same numbers of hospitalizations as we saw with Delta. Still, the sheer number of cases in our community will definitely increase hospitalizations and ICU admissions and potential negative outcomes. So we'd like to be proactive here in Sonoma County, given our specific circumstances, and limit the extremely negative outcomes such as hospitalization, ICU admission, and death.
Thank you. This next question I'm going to direct to Casey. Casey, one of the questions we have is a few people have asked is why are schools still open? If the case rate is this bad, why are we still allowing children to go to in-person instruction classes? Could you address that?
I will try to. I know how frustrating that is for people when we see our case rates going up. The state legislator, because last year we were closed, actually the last year and a half, we were closed so much that they wanted to do everything we can to keep them open, which is why we're getting tests, where we're getting masks, we're trying to support students as much as can to keep schools open, because we feel that learning in person is the better way to go. And so that right now it's a state law that we can't close and go remotely.
And Paul, if I could just add, we really want to keep our kids in school. We know what the negative impacts were of distance learning. We know that the education from many kids wasn't as good as it could have been. And we know that our disproportionately affected populations were more impacted by these school closures and those that didn't have access necessarily to laptops and methods, ways to communicate and connect with school. And the mental health of our students is very important to us in public health. So we are going to try our very best to keep schools open for kids. I also wanted to note the same issue, and Dania, please jump in and weigh in on this, is experienced by our low-income communities, our lower HPI group, our communities of color. They may be even more disproportionately impacted by the access to care and appropriate care, to getting to emergency departments, being hospitalized. And that is a real worry to me. So Dania, if you want to add, please do.
Yeah, thank you, Dr. Mays. I think you're echoing all the same things from a health equity perspective too. And when we take in consideration the impacts of this pandemic really has had in communities of color, essential workers, and how the social determinants of health affect someone's ability to live and have a healthier life, right? And also understanding that a Latinx population, although make about 27%, that were heavily impacted by the pandemic in other ways, for lack of access worker protections and living in multi-generational households. And we know the ways that our systems we are pre-existing inequities. This has been completely magnified by the pandemic. So there are other impacts as well, in addition to COVID, that our communities who have the least access to resources in our communities of color that continue to carry the burden of the pandemic. We don't want to see more suffering and more impact in folks, right? We are seeing our community suffer for long enough, and we want to continue to begin healing in a process in where we can really understand that the disproportionate impact it's affecting mental health, and also other ways in ways people ability to have healthier outcomes in general.
Thank you. Dr. Green, I'm going to see if you would direct this question to you. I have a couple here, actually. First, one of our viewers asks, would you explain how a test that was made over a year ago can still detect a variant that was just discovered a couple of months ago? Could you
The testing that we have, the testing that we have right now looks at a part of the virus that's more stable and doesn't seem to mutate as much. And so the targets of testing are very conserved. And what our testing tells us now, either rapid testing or PCR testing, is not which variant you have, just do you have one of the COVID-19 variants. So it doesn't specify which one you have. In order to determine the variant type, that actually goes to what's called genome sequencing at a more sophisticated lab.
Okay, thank you for clarifying that. I'm gonna ask you this next one as well, and this is from a couple of people have asked this as well. Basically, if the vaccines work, why are we still in a pandemic?
So the vaccines can do four things. They can stop infection, they can stop symptoms, they can improve hospitalization, and they can improve survival. So you're asking the vaccine to do four things. What we've noticed when the vaccines first came out towards more of the ancestral strains of COVID, the first variants, is that they actually did all four of those real well. But as the virus has mutated and changed a little bit, especially with more than 40 mutations in the spike of Omicron, what we're seeing now is they still hold up really good for death. So they're a survival benefit. They're great for hospitalization. They also either lower or eliminate symptoms, but the transmission risk is where the vaccine is slipping a little bit. And so we do see in a Dutch study that in household settings, vaccinated versus unvaccinated and unvaccinated people had a very high secondary attack rate. So now the vaccine we have is very good at preventing illness, hospitalization, and death, but it's losing some ground on the transmission aspect of it. So that's why we'd see some breakthrough infections in vaccination. And that's why if you don't do certain things like keep your bubble small, wear a mask, wash your hands, the risk of transmission is definitely there. And what I've noticed is that large gatherings is what starts it. And then when people go home, then there's a secondary explosion in the household, and almost everyone seems to either get sick or test positive. The good news is, if you're vaccinated, it's much safer, even though there's a transmission risk. And it's still the same adage that if you're unvaccinated, it's very dangerous to be in the community. It's a dangerous time to not be vaccinated.
I'd like
That's
to
really
just,
helpful.
yeah,
Yeah,
if
go
I may
ahead,
just add
please,
in that,
Dr. Shin.
yeah, in addition to vaccination boosters, we've found that doing a booster will significantly increase the immune response and will decrease the symptoms even further. So it does make a difference, especially in preventing the serious outcomes, as Dr. Green mentioned, of death and hospitalization. So if one is eligible, and right now the interval is 5 months after the initial series for both Moderna and for Pfizer. And boosters are now indicated for 12 and up for Pfizer only.
That's great. Thank you. We just had a number of questions from those who are claiming that this surge is evidence that the vaccine does not work. And we're getting some of those observations as well. So,
You know, Paul, I saw a really good study. It was a mathematical study out of the UK. And it showed that if we didn't have a vaccine, the death rate would be 10 times higher. The hospitalization death rate would be 10 times higher, and many economies of countries would completely collapse. You know, we've already seen, for example, you know, supply chain issues in many industries. We've seen the economic fallout. We've seen how disruptive this could be. But in 1918, none of us had the memory back then to know that how dangerous it was. So we don't know what we don't experience. And we didn't experience 1918. But imagine that. Imagine that if you take how many deaths this county has and multiply that by 10 or more. That's what it would be like without the vaccine.
yeah, that's chilling to think about. Okay, let's go to some of our media partners now. Those in the media, please just raise your hand and we will call on you. Let's start with Martin Espinoza. Martin?
Can you hear me all right?
Yeah, we can hear you now.
Okay, sorry about that. So over the course of the pandemic, the way we've gauged how we go about public health orders, measures, mitigation has evolved. First, we were looking at cases, then we started focusing in on hospitalizations. How is that going to go? How are we going to evolve next? Looking at a highly infectious variant that gives us case numbers that I can't even wrap my head around, but it hasn't got us in the same level of hospitalizations that we saw last winter. And I know, you know, we still don't know if if we're going to see even more, but do we start looking at ICU, the number of patients in ICU? What are we going to look at to determine whether or not we need more public health orders or mitigation measures or restrictions?
Yeah, I think that's a great question, Martin. And as you said, this is an evolving virus. It is changing, and the manifestations and the way in which it impacts people are different. So we have to have a shifting framework as to what we look at. So we don't look at just one thing. We're looking at multiple factors. One is case rate. And as you said, case rate may not be the best marker of how severe the impact is on the community, since there's rampant transmission now, but we're not seeing the same numbers of ICU admissions, for example, as we saw with Delta. However, for me right now, we are definitely monitoring all these factors, but I am most concerned about hospital capacity. The ability of our hospitals to take care of the community and to be there when people need acute admission for whatever it is, whether it's COVID or non-COVID conditions. And what I'm hearing from the hospitals, and that would include Sutter, Providence, and Kaiser, at different levels, they're really impacted. I've heard from both Memorial and from Kaiser that they are really at this point seeing people stay in the emergency departments for long periods of time because there are no hospital beds. That the numbers of people coming and sort of swamping the emergency departments is much greater, that their staffing is very short. So that is one thing I'm focusing on. And of course, we're looking at the entire picture as well. I don't know, Dr. Green, you might be able to add a little bit to that.
He's muted.
I really appreciate, I really appreciate that, Dr. Mays, because, for example, you know, if my wife had breast cancer and she needed to have a mastectomy, and we didn't have the OR time to do that because we're so impacted with COVID, that delay not only may jeopardize her survival for breast cancer, it also has an enormous stressful impact. And so there are some surgeries that aren't emergency surgeries, like a perforated appendix, but they're urgent and they really impact, you know, how people move through life with very dangerous diagnosis, and cancer is one of them. So I really think that's really important. Watching hospital activity, hospital capacity is really going to be paramount to how we're able to take care of the community from all different angles, not just from a COVID viral pneumonia perspective.
Martin, did you have a follow-up?
Yeah, I just wanted to take a moment to add, please. I think
sure,
the
Daniel.
other thing that we're looking from a public health perspective, it's the different layers that we've learned in the impacts, as we have mentioned before, of communities of color, right? We are monitoring closely disproportionality in terms of case metrics, vaccine metrics, and that is also part of the response and the reasoning and how it's interconnected, right? And I think it's important to understand someone's ability to isolate, quarantine, or even get to a hospital when you're an essential worker who might be monolingual speaker, who doesn't have access to technology, who can take time off and must choose between putting food on the table, right? Or continuing to be at work. So those are all things that I think we're all kind of understanding when Dr. May speaks of the bigger picture. So though that is also part of that.
And just as a follow-up, I do think we've been seeing quite a bit of media coverage and I don't want to use the word diminishing what I now call incidental COVID, but just making the distinction that this Omicron variant is not getting people as sick as previous variants or previous mutations. And that our hospitals do have a lot of people that are testing positive, but in the hospital for something else. And if anybody could just comment on, that's a pretty black and white way of looking at things. When I speak to people like Chad Krilich or just listen to Dr. Green here, it's a much more complicated equation that hospitals are dealing with, and somebody who comes in for something that's not COVID, but that tests positive for COVID may actually develop symptoms in a few days. What if you could just speak to those people who would sort of dismiss Omicron because we have such high levels of infection, but not anything near what we would expect if this was a year ago?
Yeah, so Martin, I can answer that really easily. So to put it in perspective, the Omicron variant is less severe than the Delta. That's not necessarily, that's good news, but that just means I can't impress you how dangerous the Delta strain was. It was horrible. I mean, there are some people we just simply couldn't get off oxygen for 6, 8, and 10 weeks. So the Delta strain was really remarkably more virulent than all the other strains. Finally, the Omicron is less severe. But if you look at this versus the flu, this is way more dangerous than just influenza. So not being vaccinated to Omicron or to COVID-19 is far more dangerous than not being vaccinated to the flu. And we know the flu can be really dangerous every year. To see a viral pneumonia that leads to high flow oxygen and then to mechanical ventilation, that is an extraordinary event. And we're seeing that even with the Omicron. So I'm glad it's less severe than the Delta strain, but to put it in perspective, much more dangerous than the 2017 influenza season that really already took us to capacity then.
And if I
Thank you.
can just add, the incidental COVID is actually really important because those patients are taking up hospital beds. So they may come in for a non-emergent procedure and they test positive for COVID, but then they need to stay and be isolated. Or if they're not, if they, for example, if they were to have a hip replacement, they need to go to a skilled nursing facility, but they have COVID. And so it becomes much more complicated in terms of number of bed days that they might stay in the hospital or take up a bed in the skilled nursing facility where they need to be in an isolation area. And so it becomes more complicated. So although they're incidental COVID cases, they're still impacting the capacity of our hospitals to take care of COVID and non-COVID related illness.
Okay, let's go to Catherine Ho from the Chronicle. Catherine?
Hi, can you hear me?
Yes, we can hear you.
Okay, I have a couple questions on testing. My first one probably for Casey is, can you specify how many home antigen tests were given to students and how many more you're planning to distribute and when? And then if I could come back in a sec with the follow-up question on testing.
Sure, I'd be happy to, Catherine. The state allocated 2 antigen tests for every student in the state, every public school student, and we had 67,000 in Sonoma County. So we got 67,000 boxes of tests. They've all been distributed through the school. And at this point in time, we're not expecting any more. That was kind of a one-time thing, because as you know, the availability of the test is really low. So that's what we have at the time.
Great, thank you. And then this is probably more for maybe Dr. Mace or Dr. Shende, is kind of taking a step back on testing. Are we moving toward a future where we'll be relying more and more on home testing and less on lab-based testing as we kind of normalize frequent testing as a way to, go to school and go to work?
Yeah, that is a great question. We're already moving in that direction because the rapid antigen testing is just has so many advantages. The fact that it can be done at home, there is no specific transport to laboratory and waiting for the test result. It's a 15-minute turnaround time, and it's a pretty good test, especially if symptomatic. It's not as good as the PCR-based test that goes to the laboratory and takes possibly 24 to 48 hours and sometimes longer for a result. That makes it more, the PCR tests are less practical because of that. So I do see us moving more towards this. At this time, I don't know, Dr. Shende or Dr. Green, if you want to add anything?
Not much to add, just that we know that with all the rapid tests out there, the antigen tests out there, a lot of that is not getting counted. So even though we have such a huge increase in our cases, it still is not reflective of what's out there. But I agree, the convenience of it is making it a game changer. And I think it is going to help quite a bit going forward. Dr. Green, I think you were going to add something.
Well, I think the antigen tests are really good for things that we do in the social setting, like kids going back to school. Do I get on an airplane? But when it comes to really critical clinical decisions, using the PCR test is going to be very important. So we've learned to use them differently in the medical setting.
I think that's a great point. I think exactly, they have different uses. And we're really concerned about a patient having COVID. The PCR test is definitely the better test.
Okay, let's now go to Kaylee Tournay from the Press Democrat. Kaylee?
Hi, thanks for the opportunity to ask a question. I have a two-parter and it's about schools. I hear a lot of questions from parents, from administrators, from union officials about where is the threshold as they're sort of dealing with all of these absences and quarantine protocols and isolation coming back. Where is sort of the threshold where we seriously consider going remote in any capacity? When I posed that question to Dr. Harrington in the last couple of weeks, he's reiterated how public health has the authority to do that. That schools no longer have the statutory authority to decide on their own to go remote. So my question is, my first question is, can we kind of demystify that a little bit for people? Where are those thresholds? What are the factors that public health looks at when considering whether or not to close a classroom, send a school remote, those sorts of things? That's my first question. So I'll start with that one.
No, I think since we're really talking about some of the legal issues, this may be a better question for Adam. I'm not sure if Adam is able to join us.
Yeah, Casey, do you want to take a you want to try to answer that one? Yeah,
It
whatever.
looks like
Yeah.
Adam's unmuted though.
Okay, let's see if Adam.
Sorry about that. Well, I believe that what she's asking for is what metrics or other data that public health is looking at to kind of make that determination. So I can't really answer that question. I would defer that to you, Dr. Mason, or to others on this call.
Yeah, Kaylee, is that what you're asking, is what is our threshold? Are you asking more about the state order? I mean, what is it that you're specifically honing in on?
Sure. Yeah, I'm curious, since the hearing and the public's been hearing that public health is the body that has the authority to decide whether or not a school can close for in-person instruction in any capacity and instead going remote, although I don't know how much of that aspect of it is up to the school or what. What are the threshold, what are the factors that public health officials would look at to determine whether or not we've reached a level where closing a classroom, closing a school is necessary?
I think that's a very good question. And I think it's a sort of watch and wait. We're going to see how many cases are occurring in schools, what percentage of students are out, on a daily basis. We're still trying to have the modified quarantine in place. I guess the hard thing about schools really is that we understand what the negative consequences of closing schools is and going to a virtual classroom. And that includes, as I discussed before, the disparities in access to learning for different populations and different groups. So we're very motivated to keep schools open. So it's a matter of watching the numbers and seeing what we're seeing in schools, and decisions would have to be made based on it. There's no threshold or hard criteria at this time. I don't know if Casey or Dr. Shende or Danielle or anybody else wants to add.
No, I think you're right that there's not a specific number we're looking at. If we get to 35% students absent, then we're going to close. Right now, we can't do that. The schools legally can't do that. And we're trying to do everything we can to keep kids in school. It might mean moving them to another class for a short time, but still keeping them in school.
Okay, I appreciate that. And then my sort of second part to that question is with, as of today, January 12th, are we seriously considering that at any schools? Are we watching any schools or any classrooms, as you described, Dr. Mace, do we have a close eye on any schools or classrooms, as a potential, as potentially reaching those thresholds that you kind of described here at this point in the term?
I'm not aware right now of any particular school or district that we are thinking is close to something like closing down and going virtual. I don't know, Casey, are you at SCO? Are you all seeing that? Or
I'm not aware of any. I think it's something we need to keep track of, but I'm not aware of any at this point.
Okay, thank you so much.
Okay, Martin, did you have a follow-up in that area?
I don't know. Yeah. What share? We've 67,000 tests have gone out last week. What share of those, Casey, have come back positive?
I don't know, because they were done school by school, and so each school is monitoring that.
But are they not reporting that to you guys?
they are, again, the student takes a test at home and they're asked to let the school know if they're positive. And so I think there have been some cases, but I don't know of a specific number of increase that we've had because of that.
And I don't know if Kate, if you, in public health, we may have delayed reporting as well, but do we have any idea, Kate?
Well, we wouldn't have a way to know from those tests that were distributed specifically. I think we would get notified of positives. The student may have tested through that test or another test that they had available or a PCR test. So that tracking is a little bit difficult, Martin. Around public health tracking of cases, I can say that currently our team of nurses who works on school cases is very overwhelmed. We've had a high number of cases with Omicron. So the tracking of cases on our school's data dashboard is currently delayed and can be considered an underrepresentation. We're moving to using a 7-day lag on that site to let data fill in a bit more. Right now, we have 43 student cases and 6 staff cases reported the week of January 2nd, but we know that there's more. So part of it is just waiting for that team to work through the backlog.
Thank you.
Okay, well, we're well past our scheduled end time. So we are going to end our session here. But we want to thank all of you, all of our panelists and our viewers for hanging in there with us. This was a lot of information to cover, but it was important information. So we thank you all for being with us. In particular, I want to thank our staff and our crew, as always. Thank you, Juan, our Spanish interpreter, and Elizabeth, our ASL interpreter. We will be streaming a version of this presentation in Spanish tomorrow. And we would also like to invite you to join us next Tuesday, January 18th at 5 p.m. For a joint webinar we will be doing with the Sonoma County Office of Education, where we will focus more on the pediatric vaccine campaign and the issues related to our schools and our school children. So we hope you'll join us for that. Until then, thank you, everybody, and let's stay safe.